My baby's in there!
I always knew what I wanted to be. I knew for sure, I knew for sure. I always knew it was never me. I wanted more and more.
Oh, thank you!
It's okay. None of them people gonna take it away. 'Cause they don't know.
The preceding was a dramatization, and now here's Mr. Savoie on smoke inhalation.
Paramedics, EMTs, police officers, and firemen were all part of the emergency response system. As paramedics, there's no doubt sometime in our career we will run every imaginable emergency or illness. I'm going to talk to you today about smoke inhalation. Smoke inhalation is responsible for more than half of the fire-related deaths. It is the most common cause of death with fires. Smoke is defined as hot air containing noxious gases as well as small particles of various sizes to which toxic chemicals are attached. Smoke inhalation can even cause death, and there are 4 ways that it does this. First, fires consume oxygen, lowering the percentage of oxygen in the air. This becomes especially serious when the fire is in a contained space. Second, carbon monoxide, which is found in all fire conditions, can also cause death. Carbon monoxide has an affinity for the body's hemoglobin 200 times greater than oxygen. All smoke inhalation patients should be expected to have carbon monoxide poisoning. Third, smoke impairs the body's tissue's ability to use oxygen. This effect on the body's metabolism can be fatal. Fourth, smoke inhalation causes hypoxia, which can cause the patient's condition to progress from respiratory arrest to cardiac arrest and then to patient death. Who is affected by smoke inhalation? The very young, the elderly, and the disabled are usually the victims, since their mobility is impaired or decreased, and they may not have the ability to escape a burning structure. These people may also have pre-existing medical conditions, which may increase the severity of the inhalation injury. These groups are not the only ones at risk of getting these injuries. In the course of doing their duty, firemen may suffer the same injuries. Here are some important facts that you should remember. Whenever you're presented with a burn patient, always suspect an inhalation injury. Patients with a combination of burns and smoke inhalation injury have a significantly higher mortality rate. Here are some of the signs and symptoms of smoke inhalation injuries. Always look for burns above the nipple line, carbonaceous sputum, tightness in the chest, coughing, burning eyes, nose, and/or throat, hoarseness, apnea, dyspnea, singed tissue areas around the mouth or nose. An important part of the assessment process is developing a good history. Important questions to ask would be, what type of fire occurred? Were chemicals involved or electricity perhaps? Did the patient lose consciousness? And if he did, how long was he unconscious? And did he ever regain consciousness? Approximately how long was the patient in the burning environment? If your patient was a fireman, was he wearing self-contained breathing apparatus or SCBA? Your management for a smoke inhalation patient, the highest priority is on the patient's airway. Is your patient maintaining a patent airway on his own? Your patient should not be neglected. 100% oxygen. Oxygen as soon as possible is a necessity. Early aggressive airway maneuvers can mean the difference between life and death for your patient. After an adequate airway is ensured, the patient should be rapidly transported. If time allows, you should apply a cardiac monitor. Another important management priority is checking the lung sounds and reevaluating them at least every 15 minutes. As part of Emergency Health Science 206, we've covered many topics, many medical emergencies, two of which have been respiratory emergencies and environmental emergencies. Smoke inhalation falls into both of these categories, but I felt that in our coverage of inhalation injuries, smoke inhalation was fairly neglected. So I felt it was important that I get this topic across to the paramedic class. I'd like to review in summary that the key to your patient survival with smoke inhalation injuries is early aggressive airway management and high flow oxygen delivery. So hopefully my speech has taught you that one day when you're responding possibly to a fire call, that you know what to expect and how to properly treat your patient. Thank you.
It's just about time right now. The big show is coming up, so don't move anywhere.
Stay right where you are, and after